Good evening, doctor. I hope this video finds you well. Before starting with my project, I would like to apologize for not being able to present it on my laptop. It's just that there were technical difficulties with my microphone. That's why I've stuck to recording it on my phone, if you don't mind, of course. Now, however, the technique that I've chosen to talk about is the Sirak technique, which is like the word Sirak is an acronym that stands for Chairside Economical Restoration of Economical Ceramic or Ceramic Reconstruction. Now, what is the Sirak technique? It is the newest and most used CAD/CAM in modern dentistry, and it is used to fabricate dental restorations. We hear pretty often about the terms 1-hour crown or 1-day dentistry. Now, these two terms pretty much represent what this technique is about. It allows the dentist to design restorations and crowns extremely quickly. Like, for example, we take the patient and make a porcelain restoration on a chair, and all of that in one single visit and in one sitting. This technique combines a camera, a melting instrument, and a computer in one machine. And the restorations are created in the dentist's office. Now, what are the Sirak crowns or restorations often made of? They are made of solid blocks of ceramic or resin materials, and they are mainly used to design crowns, inlays and onlays, fixed bridges, veneers, dental implants, dentures, and some orthodontic appliances. Now, how does it work? It's considered as an easy technique because it uses the latest technology, and everything is done on one machine or one system and computer. The dentist has to follow 5 easy steps, and all of them, and as stated before, all of them are done in one sitting. Everything starts with anesthetizing the area and preparing the tooth in question, and then scanning the same tooth with the Sirak computer and design, and to take the digital impression. The image is used to computerize design for dental and crown restorations, and the crown will surely be manufactured like in the pictures presented on the screen or on this slide, and after being designed, like after the restoration being designed, it will be sent to either the dental office or the remote dental lab, and of course it is mostly a type of ceramic. If it's sent to the dental office, it will surely be polished and then bound to the patient's tooth during the same visit. And if it's sent to the dental lab, a temporary crown will be made until the final restoration will be delivered, and it will be the final restoration it will be placed at a follow-up appointment. Now, each technique has its pros and cons. The Sirak technique is, of course, one of them, and it has advantages and disadvantages. One of this technique's main advantages is that it's time saving. Like as stated before, every aspect of the process is handled on site at the dental clinic and in the same day. From the digital impression taking to the final fitting of the newly manufactured crown and restorations, the range of the time, the length of the whole restoration is from 1 to 2 hours approximately. It is also less invasive, and no temporary Sirak crowns are necessary. Like they are not done except like in a few rare cases, but other than that, we don't find temporary Sirak crowns pretty often. They are not strongly required, and they are aesthetically pleasing and elite. Like there is no other type of crowns, like if we're gonna talk about techniques that feels better in the mouth other than Sirak crowns. And of course, with the help of the dentist, they can select from the ceramic blocks of the restoration a color that matches the shade of their teeth. And for greater authenticity, the dentist can paint and polish the ceramic tooth before it's kiln dried to perfectly match any existing teeth, which will give it a flawless finish and a great smile. And of course, it does not require so much work because everything is done under one system, one site, and one machine. And in this picture here, we see the computer or the milling machine or instrument of the Sirak technique. Now, the disadvantages, one of their main disadvantages is that it is not as strong as some types of conventional crowns. Like, it is a good type, but it is not as resistant as traditional and metal crowns. And they are not, ideal and part for every tooth, and particularly in situations where a tooth fracture extends below the gum line. And one of the main reasons why it is not as strong and ideal is that because it is the camera situated in the machine is unable to capture all of the teeth. So a traditional or is preferably used in these situations. And one of the most causes why many people don't go for this technique is that it is very expensive. It costs between $300 and $1,000. Like they extend so much, and it's mainly because this technique uses the latest technology, and off-site dental lab, so that's why it doesn't come as cheap. So a patient needs to always rethink of what techniques to use, and especially because they all vary in prices. Now, and lastly, they are not as aesthetic as ceramics. Like, they may be aesthetically good, but they cannot, beat the ceramics. And they are not strongly recommended for your front teeth. Now we go for some characteristics. One of them is their durability. They are just because they take a short time to be created doesn't mean that they are rust resistant, or doesn't mean that they are worse than the other types of restorations, or their quality is inferior. Like, they may not be the strongest, but that doesn't mean that they are weak. In fact, one of the main reasons why they're expensive is not only because it takes a short time, but it's also they are great when it comes to resistance. So and it's in fact helpful that ceramic is one of the strongest substances available for dental crowns. Like, as long as you practice good oral hygiene, the Sirak crown have been proven to be just as durable and last between 5 and 15 years, just like a traditional crown. So and also this technique can be worth the money. Like, it may be expensive, but we've heard from many people that it is pretty much worth it. And it is also metal free and made out of high quality ceramic materials. and which makes it stronger and more natural looking than trad dental crowns precisely. And they can be removed, cleaned, and even replaced. Like they can be bonded to our natural tooth again. They do not remain there, and in urgent cases they can also be replaced. The whole system relies on 3D images, and we've noticed that in the previous pictures and presented in the previous slides. Because it uses software to create a detailed representation of our teeth, and once completed, the melting unit and the Sirak melting unit will sculpt the design restoration out of a ceramic block, and the ceramic is chosen to match the patient's teeth in color, and so it looks aesthetically great